All right, good morning. I'm going to do cuff care. So always the first thing I'm going to do is check the patient's chart and kind of look to see what they have, if there's any details of what kind of placement they have, if they have a trach tube or an endotracheal tube, kind of what kind of cleaning supplies that I need. So when I'm ready, I'll enter the room, I'll knock on the door, introduce myself, always check the patient ID band, wash my hands, apply the appropriate PPE. So like I'm always gonna wear my gloves and everything, make sure I'm protected, and that way the safety of between the patient. So when I'm ready, I am always gonna assess the patient. I'm gonna listen to the breath sounds, and I'm also going to listen. So say the patient I have is gonna have an endotracheal tube in, so I kind of want to listen before and kind of check the placement. So if notify like how deep the endotracheal tube is in place, what the size of the endotracheal tube is, and so then I would also notify like where the endotracheal tube was when I came in the room, if it was in the middle or if it was on what side of the mouth that they had the tube at. So that way when I'm ready, I can change it to a different side when I leave the room. So always when you have figured out, charted kind of what size of endotracheal tube you have, and you're ready to go. So before you begin, so you always want to change anything that needs changed. If there's any gauze that need changed, any tape that might be on the patient, make sure you're holding it stable so that way you're not moving the endotracheal tube. And then you're also going to go ahead and do an oral care. So I'm going to say this oral care is with the toothbrush one. So you always want to clean their mouth and everything before you do your cuff care. So what I'm going to do is going to go ahead and get my supplies ready. So you'd always, when you're doing, go to do oral care, so you always want to have your suction, the Yankee suctioning with you. And so you can suction out any excessive secretions that you may see before you do it. And so then you always, so when you're ready to go, so you're going to attach your toothbrush that you have to your suction, and you're going to take your anti-plaque and you're going to dip it in there, and you're going to go ahead and do one side from another. So you're going to go ahead and brush your teeth, and you're going to do it in circular motion. And so then when you're ready, and then you'll switch it to the other side and do the other side and brush it around. And so then you can go ahead and suction. When you're done, you can put your anchor back on, and you can suction out any excessive anti-plaque solution. So always when you're done with that, always dispose of it. Then what you're going to do is take your moisturizer, and you're going to moisturize the patient's tongue, sides of the cheeks, around the gums, the lips, both sides. And so then always, and you want to, you always place the endotracheal tube to a different side, so that way it's not always in the same place, so that way you don't start getting sores in one area. So then when you're ready to do your cuff pressure and checking to see where you're at, so what you're gonna do, so here we would have a connection. So what you're gonna do is have one of the connections gonna be connected to your syringe, and then the other one is you're gonna have your meter placed on the other side, so that way you can see where you're at when you're doing the cuff pressure when you start releasing it. So always you're gonna first off do is your MOV. So you're gonna listen to the patient where the cuff is, and so you're gonna occlude. So if you hear any of that leaking sound, you're gonna occlude that to see, and you're gonna notify, chart down kind of what the pressure is at. And so when you're ready, then you're gonna slowly, and you're gonna go ahead and take your syringe and say this is where your deal is. So you're gonna go ahead and slowly start taking out the pressure. And as you're doing that, you're also going to be listening to make sure right when you get to that point to where you start hearing that leaking sound, kind of you're gonna chart down where that is at, where the minimal leak is there. And then when you're ready, so then you're gonna also go ahead and get it back to the appropriate area, the 20 to 30. So you can have your meter, when you're doing it, you can check to see where it's at, so you can go based off, you need to have it in the green, so when you're doing it, then you go put it back up and make sure the cuff pressure, and listen to make sure there's not too much of a leak or anything like that. You want to make sure it's in the appropriate placing to where it's not too tight in the patient, and that way it doesn't cause any sores or swelling, where you can get more complications that way. And when you're all finished and everything is all good, you checked and listened with your stethoscope to the patient where the cuff is, and everything is in the right appropriate numbers, and then you can go ahead and reevaluate the patient. Make sure the settings and everything, for your endotracheal tube, everything is set up correctly and appropriately at the right values. And that's the end of the patient's lung. Always get the vital signs, and then you always want to make sure the cuff is still in place. And with the endotracheal tube, as always, if was set in one place when you came in the room, always change it to the other side, so that way they have a little bit of movement. That way they don't get any sores just from it sitting in one area. So after that, I've cleaned everything, make sure everything's disposed of, wash my hands before I leave the room, and then I would go and chart on the patient's chart.